Hello, everyone. My name is Carly Burridge. I'm the owner and founder of Gaining Health, where we help healthcare providers and organizations with starting or optimizing an obesity management program. And every Wednesday, I do an episode called What's Up Wednesday, where I discuss either a recent journal article, a recent study, or a recent book on the topic of obesity. And we kind of talk about how you can use this in your clinical practice. So today, what we are talking about is a recent journal article from the Obesity Journal, May 2021 edition. And the article is called Exercise and Adipose Tissue Immunity, Outrunning Inflammation. And it's a review article written by Nathan Wynn et al. And this article summarizes how physical activity can modulate and reduce inflammation caused by obesity and adiposopathy, or so-called sick fat disease. So as we already know, obesity can cause adipose tissue remodeling when that adipose tissue is forced to hypertrophy beyond its natural capacity. And that leads to this sick fat or adiposopathy and to this low-grade inflammation throughout the body. And we know, of course, that this inflammation is one of the things that connects obesity to so many of the different medical conditions that are caused by obesity, including insulin resistance and type 2 diabetes, osteoarthritis, dyslipidemia, depression, and also certain kinds of cancers and numerous other complications. So we know that this inflammation is really important and a really problematic aspect of obesity that we need to see if we can find solutions to overcome that. Now, the interesting thing with physical activity is that research has consistently shown that regular physical activity reduces inflammation and improves immune function. However, the exact mechanisms by which exercise modulates immune function, and especially in obesity, is not fully understood yet. So this review article summarizes the findings of what we already know and also some of the things that we don't know yet. So the authors note that there's several mechanisms by which endurance training in particular can regulate adipose tissue inflammation and immune function. So one way is if the exercise or the physical activity results in a reduction of adipose tissue, or AKA we think of this as the weight loss component, right? And this is the mechanism by which most people will assume that exercise is beneficial. So if you exercise and you lose weight, that's going to reduce inflammation. However, it should be noted that many of the effects of physical activity are not contingent upon weight loss or a reduction in adiposity. So that implies that there's a lot of other mechanisms by which physical activity modulates adipocytes and the immune system. So this review article really goes into some of those additional factors that have nothing to do with weight loss that we still see with exercise, with regular exercise. So one of the things that physical activity has been shown to do is to improve the vascular supply to the adipose tissue. So that's going to result in improved nutrient delivery, and it prevents some of the hypoxia that we see in obesity, especially when the adipose tissue exceeds its natural capacity to hypertrophy. So when it doesn't get enough oxygen supply because the vascular supply is insufficient to provide oxygen to the adipose tissue, that can result in apoptosis or cell death of the adipose tissue. And then that results in subsequent inflammation and fibrosis. And also you can get that leaking of those free fatty acids into circulation. So one of the ways that exercise helps reduce this is it improves the vascular supply. So that's really important. Another thing that physical activity does is it can actually decrease immune cell recruitment. Okay, now sometimes we might think that that's a bad thing, but this is actually done in a way that does not compromise the innate immune system. And part of the way that it does this is actually through hematopoietic reprogramming that is triggered by physical activity. Another way that physical activity can reduce inflammation is through the release of cytokines during muscle contraction. So when a muscle contracts, when somebody's being physically active, the muscle releases myokines, sometimes also known as exerkines. And there's hundreds of these that get released when a muscle contracts. And of course, that acts as signals throughout the whole body. And one of these factors that gets released, which might be familiar to you because it's also released by adipose tissue, is called IL-6, interleukin 6. So IL-6 is pro-inflammatory, but when it's released during exercise, it then triggers the release of IL-10 and TNF beta. So TNF alpha is pro-inflammatory, TNF beta is anti-inflammatory, and IL-10 is anti-inflammatory. So it actually triggers an anti-inflammatory cascade. And IL-10 also improves insulin signaling, and so thus insulin sensitivity. And in addition to that, exercise has also been shown to enhance macrophage phagocytic function, so the phagocytic function of the macrophage. And there's one exception, though, to some of these improvements in the immune system, including the macrophage phagocytic function, and that is prolonged high endurance exercise. So the example they give here in this article is like ultra marathons. So we're not talking about, an hour or an hour and a half or like a HIIT class. We're talking really prolonged high endurance exercise. And that can actually reduce the macrophage function. And whether this type of training actually increases the susceptibility of infection has been debated, and there's been mixed findings about that. So we're really talking about your moderate intensity, sometimes high intensity physical activity as well, as long as there's enough rest time and it's not prolonged. And then lastly, exercise independently improves adipose tissue endocrine and immune function and alters the production of those adipokines. And studies have shown that when you transplant the adipose tissue of a trained mouse into a sedentary mouse, it actually improves the whole body insulin sensitivity and glucose homeostasis of the sedentary mouse. So it highlights that there's this intricate level of skeletal muscle and adipose tissue communication that really links metabolism and immune health. So again, that's just so important to recognize. So in conclusion, physical activity really does confer a lot of these anti-inflammatory benefits on a whole system level and improves immune function. And many of these effects are independent of weight loss. And these effects can counteract some of the inflammation that's caused by these inflammatory adipokines that we can see in obesity. So this is a whole interesting new field, often called immunometabolism or exercise immunometabolism. This field is still at its infancy, but it's a really exciting up and coming field, and we have so much to learn, especially also the role of this in women. It seems like a lot of the study is done in men and males, and so we still need to see if women have the same effect. So the bottom line here is that there's a lot more to physical activity than just the calories out of the calorie balance model. And it also even goes beyond maintaining muscle mass, which is another thing that we talk about regularly when we're talking about obesity treatment or weight loss. So both of those things are important, but we have to recognize that there's so much more to the benefits of physical activity than just the calorie portion or the muscle mass portion of the equation. So when we talk to our patients about physical activity or nutrition or sleep or any of those things, we really need to discuss these things as signals and inputs that your body is receiving, and that this input has far-reaching consequences on health beyond just the number on the scale, and that this is really so crucial when it comes to improvement of health, which is really at the end of the day what this is all about. All right, so that's all we have for this week for What's Up Wednesday. If you want to find out more about Gaining Health and our services, if you are a provider organization who's looking to either start an obesity management program, or if you have one and you're looking for ways to optimize it, please check out gaininghealth.com to see what resources we have for you there. And I look forward to seeing you back next Wednesday for another episode of What's Up Wednesday. All right, take care. Bye.